Kybella is a liposuction in a needle, I like to call it, an FDA-approved injectable drug that we inject here in the dermatologist's office. I do it myself. I did the clinical trials for Kybella. I like the drug a lot. It works really well because every single time you use it, the fat pad underneath the chin gets smaller and smaller and smaller. My patients are very excited by the results, although they are gradual. I explain to people all the time that what happens with Kybella is the following. You inject it into the area that you want to target to decrease fat. Once you inject it into that area, what happens next is you can get some immediate discomfort, tingling, tenderness, and even some pain for about 22 minutes. So I have patients hold ice, use ice, and they drive off to go to their job after we inject them with Kybella. Over the next 2 to 3 days, it swells up significantly. Those days, my patients are wearing turtlenecks. They might ice it a little bit. They might wear a scarf on their neck. But basically what's happening inside of their body is that Kybella is busting apart their fat cells, because Kybella is what we call deoxycholic acid. And so it's a synthetic derivative of what our gallbladders secrete to fight fat within our system. And here we are injecting it into trouble spots where there's fat to get rid of the fat. So it's really cool technology. Off-label, I'm using it for the upper arms, I'm using it for the back, I'm using it for the lower abdomen, I'm using it for the inner thighs, and I'm also using it for that little bit of bra fat when people put on a bra and then they have a short-sleeved shirt on and they can just see a little poke out of fat. I am using it some for that. However, in those cases, I recommend that people get an ultrasound or a mammogram first to make sure that they have no issues with their breast tissue prior to getting started with the Kybella. The Kybella itself is used probably 50-50 in my practice, so 50% men use it, 50% women use it. I love the consistency of the results with my patients with Kybella when they're using it under the chin and in different areas on their face. I like the fact that there's not a lot of downtime with this procedure. And I like the fact that I can explain to my patients it's localized, injectable liposuction in a needle. And my patients are really into that description, and they instantly want to sign up. So this is one of those technologies that works. It works well. It can be used in all skin types, and it can be used on both sexes. If your skin is way, way, way loose under your jaw, then you might want to reconsider using it. If your skin is way, way, way loose in between your thighs, then you might want to consider using it there. So for very loose skin, maybe you wouldn't use it. For somebody who's in great shape, who has good skin turgor, you would absolutely want to use it.